it is my pleasure to introduce Susanna Mak.
So good evening, everyone, and thank you so much for taking time out of your schedule to join us today. It's really nice to see some friendly faces. Multiple generations are here. It's nice to be here with my actual mentors. Gary Newton was one, John Flores was one. So it's been it's a very special evening. So my laboratory in our socials is known as @MacLab, and I'm going to tell you a little bit about cardiology, physiology research here at Sinai Health. So there are many ways to study the heart. You can actually study its cells, or you can study people who have heart attacks. But we study the heart as a machine. That's really what physiology is. The heart is a very well-tuned and complex machine. And just like this beautiful race car, you might look beautiful on the outside, but if the engine don't work, nothing moves. So that's really how we fundamentally address heart function. And I get to do this in this really cool facility, which many of our friends here today have helped us build. It's known as the Harold and Esther Mecklinger and the Poslins Family Cardiac Catheterization Clinical Research Laboratory. And you keep hearing people say that we're relatively unique. It's because we can place monitors directly into the heart, as you can see here. This happens to be a study of athletes, chronic triathletes, exercising with tubes in their heart to measure their function, as well as a simultaneous sonographic image. And we can get beat-to-beat measures of their heart function. And we can only do that in this very special facility that's been purposely built for us to do this type of physiology work. It is unique in Canada and actually relatively unique internationally. So what does that mean to create a cardiac physiology research laboratory? We actually refer to it as a research platform, and we see it in 3 themes. So we look at at core cardiovascular physiology. So that's asking the fundamental question of how we all work. So what happens depending on whether we're male or female? What happens as we age? Those are what we refer to as core physiology. And I study anything from normal individuals all the way up to athletes to try to figure out how an athlete works, like what allows them to function at such a high level. We then take that core knowledge to understand clinical issues, clinical models, and we try to create diagnostics, right? So we study one extreme of athletes who can achieve so many things, and then we study the other extreme, people who find it hard to get out of bed. And we try to create diagnostics and investigate problems such as heart failure. And then because our signals are so difficult to acquire, we also have several industry partners and people who want to commercialize devices to measure some of what we do non-invasively. You're going to hear a little bit more about some of the disease physiology from my colleague John Flores, and you're going to hear about our device and digital program from Darshan Brambat. So we try to understand the patient experience, right? We want to understand some fundamental questions. And one of the commonest questions we get from patients is, why can't I breathe? And one of the taglines for my laboratory is that the ability to exert or exercise is a fundamental right? It's fundamental to human health and well-being. And unfortunately, the sensation of not being able to breathe is extremely common and quite disabling. And it's seen across the spectrum of healthcare, from the emergency department to our clinics. And certainly those of us who care for patients with heart failure, that's their fundamental concern. Why can't I breathe? I'm not going to go through this in depth, but the way we approach this is we develop a set of core knowledge in terms of understanding how the heart works to support exercise in normal men and women. And we've turned that kind of knowledge into diagnostics. And we've actually now developed with other investigators internationally a network of people that do these specialized diagnostics. I've also taken this kind of knowledge in part of our assessment of patients with heart failure and pulmonary hypertension, and we've created some unique databases, again, to understand the relationship of how someone feels, to how someone physically works, to what happens to them ultimately. So we do that with signal processing and a few other types of research methodologies. And then we take that kind of knowledge then to try and actually solve problems for people. So as Dr. Ross said, we've become a destination to try and understand or diagnose people who have breathlessness that seems to defy diagnosis. I'm not going to go through this at length, but this is just an example of a 38-year-old person with disabling shortness of breath. And you can see from all of the lines here, she was investigated for 4 years. She was unable to walk her child to school. She was really desperate, as were her physicians. And they simply asked us to please assist us in sorting out the cause of her shortness of breath. So what we did was we brought her to the laboratory, and because of our experience in doing these types of procedures in healthy people, we had really good understanding of what was normal and what was abnormal. So we performed what we call a right heart catheterization, inserted catheters into her heart while she was lying down. What we've been able to do, though, is to actually learn how to do this and move this patient to a bicycle exercise platform, and then we're able to exercise her. And again, we have, from our physiology work, a really good understanding of what is normal and what is abnormal. We can actually make specialized measurements of her gas exchange, and finally obtain special measurements of the oxygenation of her blood. And with that, we're able to arrive at a diagnosis for her. And what we're able to do is actually assign her a treatment that will truly help her. So before she came to the laboratory, she was going through this cycle of visiting doctor after doctor after doctor, being given a whole bunch of false diagnoses that were then retracted. And she thought she was making it up, or she thought people thought she was making it up, when we were able to really determine what the physiologic abnormality was. So after our type of research study, this is actually an experience from colleagues of mine who do very similar work. And what people can do when they come to the laboratory is we can then start to really understand what the problem is. And we can diagnose heart and lung problems in some cases. We can also diagnose problems with their peripheral musculature, their ability to use oxygen. And what it does is it stops the cycle of people going back and forth to doctors without a diagnosis. So the next challenge we're taking on, and I'm doing that with my partner, John Flores, is to try and answer the question for some patients as to why can't I stand up? So there are many patients who have what we call orthostatic intolerance. It's a bit of an epidemic, certainly growing in frequency after the COVID pandemic. And we've turned the same approach into understanding how the heart works when we stand up as we did for exercise. So in the last few minutes, I want to talk about building our capacity. So we can only do this because we have this very specialized facility that I hope some of you will join us to look at upstairs. And we're going to renovate this facility in order to increase our capacity to study these types of individuals. And this just shows you the floor plan of our renovation. We've been supported by major project or infrastructure funding from the Ontario Research Fund. You can see some of the names of our projects below. This picture of me is not to show you me, it's to show you the equipment behind me. We need to also replace this equipment because this is the stuff that allows us to do what we can do. In order to make this kind of thing work, we need to put together a network of funding. So I have a network of peer-reviewed funding sources, both government, industry, and other. And of course, as many of you here tonight have helped me with, we cannot do this without the contributions of our community. The final thing I'd like to talk about, one of my trainees is here tonight, Elizabeth, who actually did her PhD in the laboratory. The other thing that our philanthropic partners have helped us with is contributed to the training of the next generation. And these are just some of the faces in our laboratory. And these are just some of the names of the last couple of years that have actually finished their training in my lab, who have gone on to lead programs similar to mine in Singapore, in Brazil, in Australia, and other parts of Canada. So with that, I'm going to stop. I really want to thank you for joining us today. It's a privilege to be able to work in this institution, and especially in partnership with so many of you. Thanks very much, and I'm going to hand it back to Alan.